Thanks for coming along to our fourth project show and tell. This is, we'll be discussing our Here to Help project and developing the Here to Help tool to onboard both coronavirus helpline users and also the contact tracing service as well. Before we get started on the content for today, for those of you who aren't aware, show and tell is one of our regular methods we use to keep everyone updated on project progress. And we really hope to use these sessions as an opportunity to get feedback and input from you as well. So if you have any questions or thoughts throughout, please feel free to contribute. We'd love to hear your views. So for this project, we have a core team, which includes colleagues from multiple services across the council, as well as colleagues from Maytech as well, which is an external digital agency. And we're working together as a team to deliver on our project vision and context, which I'll run through in a second. But the other things that we'll be discussing today are around where we are with progress. We've had really large work streams to work on, not just over the last sprint, but really over the last 6 weeks. So we'll give an update of where we are with those different work streams. We'll also be spending some time today to talk about what we've learned over the last sprint, which I think is really important as we've missed some deadlines, and we're going to offer some initial reflections on why we think we've been delayed in getting or releasing some of our work. And we'll also talk about how we've adapted our ways of working to respond to our new timelines and targets. And finally, we'll also be talking about next steps. So once we're over this big release of these 3 work streams we've been working on, we've got some additional functionality that we'd like to be building into the tool. So we'll be talking about what those features will look like as well. So on our project vision, we want to develop the Here to Help tool as a single database and user interface to support 4 key strands of the Council's coronavirus response. And really this tool should enable call handlers to have the best possible conversation with residents who have been affected by the pandemic, and we want to make it easy for users to link residents with the support that they need. And those 4 services are contact tracing, and the other 3 are all under the coronavirus helpline. So those 3 other calls are welfare calls to those who need to self-isolate, the coronavirus helpline, and the inbound calls that helpline receives. And then finally, outbound calls to clinically extremely vulnerable residents. So these are residents who have to shield during national lockdowns. And for the Here to Help tool, our goal is to onboard these 2 services, the contact tracing service and the coronavirus helpline, into using one tool which meets their needs. So if a person's a Here to Help user and they're on the coronavirus helpline, then currently they will be using the old front end, which has been in place since last spring, but they'll be using our new database, which went live last week. If, however, a user is in the contact tracing service, over the next few days, they'll be testing our new front end, which we're really excited to be releasing, and they'll also be using the new database. And then where we want to be getting to with onboarding these 2 services is that they're both using the new tool, which is the new front end and the new database together. So where we are. The large piece of work that we've been working on for over a month now are related to data ingestion, creating a new database structure, and designing and delivering a new front end. So on the data ingestion side of things, the purpose of this piece of work was to enable automatic daily uploads of records onto Here to Help. If we look at the contact tracing service, that's particularly important because managers on that service spend a significant amount of time each day, around 70 minutes, completing burdensome manual tasks to create a day's callback list for that service. And what this data ingestion process remove all those tasks. It will clean the data, deduplicate it, and then present it in our Here to Help tool for contact tracers to use when they're making outbound calls. In terms of updates, this is currently working on production, but we're not yet able to use the processor yet with the contact tracing service. On our new database structure, we undertook this work to create a more sustainable structure long term. And importantly, what we wanted to do was to separate out a resident on the tool from the help request, which is associated to that resident, so that they can have multiple requests across different call types. And that's really important because we'll know that some people who need a contact tracing call will also need a call because they're shielding. And we also know that some shielders will also require welfare calls, for example. It's really exciting. We went live with this new structure at the end of last week, and the users on the coronavirus helpline are currently using the existing I Need Help tool with the new database structure, but we're looking to onboard them to the updated Here to Help tool over the next week. And then finally, we undertook a really large piece of work around designing a new front end. And this was to create a solid foundation to build additional features on going forward. And importantly for other teams, it could act as a reusable component that other services might want to use. We've been doing a lot of work to research and test this new front end, and that's testing with both the coronavirus helpline, but also the contact tracers as well. So we've got a really clear sense of their needs. This isn't live yet, but we're hoping to do live testing with contact tracing call handlers shortly. And I'm just going to pass over to Zoe. He's going to talk about some of the learnings we've taken from the last sprint.
Great, thanks, Chris. So I guess the first thing for us as a project team to be really upfront about to this audience is this has not been an easy few weeks at all since the beginning of the year. We've missed several deadlines for getting our contact tracing colleagues onto the Here to Help tool, and we know how important that is for some of the reasons that Chris just described. And so I guess this is partly an apology to lots of the people on this call whose lives will be made much easier when this does happen. I think, what we wanted to do was use this session to share learnings from the customer service colleagues who are doing contact tracing about the impact that the new tool has made, but we don't have that yet. And I think partly inspired by a hack at All Hands show and tell last week, where Rob Miller and Philippa spoke very convincingly about how, as a service, we have to sort of apply working in the open in the genuine sense, rather than just giving new names and formats to sort of old ways of working, that we actually are quite clear about what is causing the delays. Having said that, we haven't done our retro yet. We've got that this afternoon. So this is very much just reflections, and particularly for the team members on here, I don't want to for this to preempt the much more detailed conversation we'll have in our retro. So there's a couple of big things that we've been reflecting on, and maybe this isn't quite the right order. So starting with that third one. Yeah, as you've seen from that, we've had to really rebuild the front end from scratch, and also completely reconfigure the database from the existing tool. And I think one of the things that we've struggled to do is retain that MVP approach. And I say that very much for the whole team. So from the product side and the design side, thinking about how we chunk up this work in effectively for the developers, so that they really can sizes. I think one of the root causes of some of our challenges has been that we were starting from the I Need Help tool that was absolutely created in a very short space of time to deal with a sort of very live crisis that was, how do we get food deliveries sent out to several thousand households every week during the first lockdown. And what the team has found is that, the front end to that, because that was built very quickly, the front end was built in templates rather than sort of fully in React as the new front end is now. So we were able to start this project quite quickly and be releasing value really, really rapidly. And that was really important because when we started this project, we were suddenly asked to step up outbound calling for she orders very quickly. So we were really able to get into that good pattern. But the more work we did, the more we realized that we were really building up technical debt there, because without a properly designed front end, we weren't going to be able to go far with it. Similarly, with the database that we were using was just one table, so we were able to continue to make small iterations to that, but we knew at some point that we'd have to stop and start again. Similarly, I don't think Chris mentioned it, but there was very little testing coverage on that first document, that first tool that we started from. So I guess an interesting question, I don't really know the answer to, which is like, were we right to start from the I Need Help tool, or should we have started from scratch? Or how could we have predicted these challenges earlier on in the project to release the sort of big bang period that we've caught ourselves in now? And I think the other big question that we've really been thinking about is really, really good internal alignment across big strands of work in a big project team. So we're 7 developers, I think. Is that right? I think we've just been saying that. With 7 developers on this team, which is huge. And it is, I think the one thing is we haven't actually scaled up the number of user researchers, designers, product people to support that many developers, which might have caused some of our problems. But also, you know, because we've been doing the back end work on the data ingestion and the front end work on the front end, we have been inadvertently, I think, creating blockers for each other, and it's very difficult to decide whether to spend more time in the day communicating or more time in the day doing. And I think it's always hard to know what the answer is to that. So that's, I think, some of the questions that we've been reflecting on, and will continue to do so. And I'm sure there will be others that come up, but particularly for other ICT colleagues on the call, always happy and interested to hear other people's thoughts on those themes. Thanks, Chris.
Thanks, Zoe. So as I mentioned, one of the issues we've had over the last few weeks is the size of the work, and it's been quite difficult to track work progress because the work's so large, and also we haven't really determined what's the best way of presenting user stories and then converting them into tasks as well. So we've decided to get back to basics on Trello, so we've got a really clear sense of what we're doing. The image on the left is our Trello board, which got quite out of control. So this is all the tasks that we've had since the project started. It includes our epics, it includes our product backlog, but it's just been very difficult to follow the prioritized work on this board because there's so much noise on it, there's so much detail. So what we've done as of this morning is switch to a new Trello board and kept it very basic. So it's work in progress. It captures things which are we're doing next, what we're doing now, any tasks which are blocked, and then what's been done. And there's much less detail on this new board. We're able to track things much easier. And if we're happy using this, I think we'll be using this newer board going forward rather than the very detailed one that we have on the left. And we've also been adapting in other ways as a response to missing our deadline. So as of Thursday last week, we started having daily team stand-down meetings, and this was because the work days were so busy, the work's very challenging and complicated, and so it's really useful to take stock at the end of the day, discuss what was achieved, and what needs to be the priority going into the following day as well. Using the new Trello board, we're also separating tasks between different team members. This is because mobbing on some of the tickets to get the tool ready for live user testing was really useful. But now that we've got a clearer sense of what needs to be done, we can separate the tasks out by tasks which are needed to complete. the tool to get it ready for live testing, and those tasks which can resolve some of the tech debt that we've accumulated, so that we're working in more efficient ways going forward. And then I think we've all got a clear sense of this at the moment, that it's been really challenging working on these large pieces of work. So once we begin our new pieces, we really want to refocus on smaller tasks that we're delivering to users rapidly, just so that we're getting that more efficient cadence, and we're seeing smaller chunks delivered quicker to users, which is what we're really interested in. I'm just going to hand over now to Claudia, who's going to run through some of our next steps on the project.
Thanks, Chris. So what we're immediately focusing on is getting contact tracers to use the tool for every shift, so getting it up and running for them, and making sure that they can view the callback list, assign calls, see resident information, log call outcomes, everything that they can currently do, but all within the tool. And once we've tested it with them, we'll learn and iterate and improve it as we go, so that the next thing we'll look at is getting the COVID-19 helpline to use the tool, who are currently using the existing tool. So to do that, we'll need to apply the data ingestion process from contact tracing to both the CEV shielding calls and also the welfare tool. And then future iterations. So I'll go through these in some more detail, but as a summary, we want to basically automate the data ingestion process for a lot of the big block calls where there are a lot of residents, and at the moment that's a very manual process, as you saw with contact tracing. We're also looking at embedding the scripts and the CTAS forms, so that's the contact tracing program, into the HID help tool itself, and to integrate GovNotify and finally automate the reporting on the service data. So firstly, integrating scripts and CTAS into to help. So just to give you some context, at the moment, the call advisors are using 3 different scripts when they're on calls to people who've tested positive for COVID. They're all about sort of 4 to 6 pages long, and they were set up really, really quickly and responsibly when we first started doing contact tracing, but they can be quite difficult to navigate, and they include a lot of conditional logic, which is hard to do when you're on the call with the resident. While they're doing this, they're also looking at CTAS, which is the national program where you input all of the actual data around contact tracing, which we can't extract data from either, so we don't have any access to the public health data that's going in there. So I think at the moment, contact tracers currently have about 7 tabs open when they're on the call, and we've done a lot of observations of calls and listening. You can hear what a struggle it is for the contact tracers to sort of jump between them, and also therefore sort of the conversations can be quite difficult with residents. So what we're looking to do, Chris, thanks, is integrate both the scripts and the questions into CTAS. So we're going to use Typeform and embed it into the page. This is just an example of what it would look like. You can see there the script is a lot more reduced. We've been filing a kind of bullet point version of the script with the contact tracers the past few weeks, which we developed with some of them as well. So it's very much come from their use of the script, and changing it to be more of a kind of bullet point checklist rather than a word for word script. And what we hope that will do is just make it a bit easier for the contact tracers to build their own language around the tool as well. Next one. So this is an example of what the contact tracing could look like. So where you're actually inputting the contact details. And I haven't got a screenshot of CTAS in here at the moment, but just believe me when I say this is a nicer interface. And hopefully it won't crash as much. So doing this will hopefully make the experience much better for residents, because as I said, it can be very disjointed as someone's trying to navigate between 7 different tabs and reading things word for word. So hopefully it'll be a more engaging conversation, and it can be quite lengthy. It can be quite frustrating having to think back 5 days ago where you were, what the address was. So as seamless as we can make that, the better. It also hopefully make the experience better for contact tracers, so that they can actually build their own language around the scripts and feel more confident and have more ownership over what they're doing, and will reduce the cognitive load for the contact tracers, because they'll be only using one program for all of the tasks, and the tool will navigate all the conditional logic of the scripts rather than the contact tracers themselves. Also, and really importantly, could have a really big benefit for public health, because we can actually use the data from understanding that contact tracing, where people have been and who they've seen, to find hotspots in Hackney and do a bit more of sort of proactive preventative work. The second thing we're looking at is integrating Gov Notify into Here to Help. So at the moment with contact tracing, for example, texts are sent before and after the calls, and this is a manual process which can take some time. But the new process, it will be integrated into Here to Help. So once again, all in one program, in one page, and much easier to do sort of mass texting. It would also sort of give call advisors the option to text residents after their calls, so they can actually personalise and tailor the texts, which would be really helpful with the sort of shielding calls and welfare calls if there's specific information that they've gone through on the call. And finally, also looking at reporting on service data and improving both our ability to report and what we're reporting on. So at the moment we're reporting on things like total complete cases and unsuccessful cases, but with the new process, especially if we integrate the CTAS questions into the tool, we'll be able to have a much wider range of metrics that we're reporting on. It'll be automated by Tableau and also visible in Tableau, so much easier to kind of look at and analyse. Anyone got any questions?
Thanks, Claudia. Susan, good one in the chat, which I do not know the answer to. So Susan's asked, like, with the benefit of hindsight, what questions do you think we could have asked ourselves to reach the conclusion that it might have been better to build from scratch? I guess I'm not convinced that it would have necessarily been better to build from scratch, but I think it is maybe not a conversation that well, it's definitely not a conversation that we had before we started. And I don't know if anyone else on the team has got a suggestion on the answer for that, but it could certainly be something that we think about in our retros. Andrew, sorry.
I'd say that discussion, I think there's, like, in terms of complex systems thinking, people often talk about path dependency. So for people not familiar with that jargon, it just means that the things that you do send you on a path, which you sort of end up semi-committed to. And the fact that we already had invested time and effort in developing the initial tool, it would have taken a great deal of bravery to say that was a dead end, and then to backtrack so you're worse off than where you started in order to reach a higher peak in the future. So I think that is just a very sort of textbook example of having to deal with, like, a complex adaptive system like this. So I think for me, it would be try and have that conversation at least, even if at the time it seems very obvious that it's not the right thing to do. Just to allow yourself the space to have the conversation of exploring all possible options, even if initially it might seem like you're going backwards.
Yeah, that's interesting. Thanks, Andrew. Very much open to the developers as well on the call, if and I know lots of people will have worked on similar things. Any other questions? Right.
If not, I just want to say thanks so much, everyone, for making time to join the show and tell today. Really appreciate you being able to attend these. We'll share the slides after this meeting and the recording, and our week note will also go out at the end of this week as well. would love to get your ongoing feedback and input into this work over the next few weeks as well. So please get in touch if you'd like to have a conversation about any of the things that we discussed in this session.
Thanks, everyone.
Thanks, everyone.
Thanks, everyone.